Hello and welcome to Unstressed with Dr. Ron Ehrlich. Have you ever heard any confusing health messages? Have you ever wondered whether you should be on low fat or high fat? And do you always wonder when these messages change and who to believe? Well, my guest today is Dr. Ross Walker. Now, apart from being an internationally renowned cardiologist, he's written over 7 books. He's got his own 2-hour weekly national radio program called Healthy Living. We'll have links to all that. He describes himself, and I love this term, an integrative cardiologist. Can't quite get him to say holistic, but he is an integrative, and you'll hear what that just means. He's actually my own cardiologist. He happens to be an old school friend of mine, a font of great wisdom and a great conversation. But Ross talks his 5 keys to eliminating 70% of all chronic degenerative diseases. He's going to share those with us. The whole story about cholesterol, you know what? I mean, honestly, cholesterol is an important part of every single cell in our body, and as Ross will point out, a whole lot more than that. So we're going to clear up that myth. I mean, this whole business about fats, okay, you've heard it before, but how about hearing it from a cardiologist? So I hope you enjoy this conversation with Dr. Ross Walker. Welcome to the show, Ross.
Oh, thanks, Ron. Pleasure to be here.
Now, Ross, you describe yourself as an integrative cardiologist?
Yeah, I think that's the best way to do it. See, what I believe in is combining the best bits of orthodox medicine or allopathic medicine with the best bits of complementary medicine. And you see, the concern I have is that there are people who are at the extremes at either side, people who believe that if you can't fix it with a script pad or a scalpel and it doesn't work, but then you've got other people in the complementary medical world who think that anyone in orthodox medicine sits at the right hand of the devil. And anyone with any common sense knows that that's nonsense, that both sides are nonsense. You've got to work, as the Buddhists say, follow the middle path, go somewhere in the middle, which is combining the best bits of both, which is what I think I do.
Yeah, I think that's what I do too. I know, wouldn't use the word holistic, would you, Ross, or is that a...
Oh, you can use the word holistic if you like. Some people like holistic. I prefer integrative.
Integrative. I like it too. Now, listen, after all this time, you know, where we've been following all the advice that we should be, what we should be eating and all of that, how come heart disease and cardiovascular disease are still number one? What's the story there? What are we doing wrong?
People aren't good at doing exactly what you said. If we all followed the 5 keys of being healthy, and I'll summarise them quickly because we've spoken about this on numerous occasions before, but the 5 keys of being healthy is to have no addictions. You cannot be healthy and smoke, drink too much grog or snort cocaine. Number 2 is to have good quality sleep. So 7 to 8 hours of good quality sleep every night is as good for your body as not smoking. Number 3, and this is one of the keys, eat less and eat more naturally. That's all you need to know about diet. All this nonsense about low-fat foods, stuff that's masquerading in a box as food. I mean, we all know that that's rubbish. We don't need to follow low-fat principles. We need good quality fats, we need good quality proteins, and good quality carbs. The best quality carbs on the planet are things called fruit and vegetables. So it's eat less and eat more naturally. That's all you need to know about nutrition. Number 4, second best drug on the planet, 3 to 5 hours every week of some form of testing exercise that should be about 2/3 cardio and 1/3 resistance training. And finally, the best drug on the planet is happiness. Now, those 5 key principles together reduce your risk for all diseases 70 to 80%, cardiovascular disease 83%, but the point is most people fall down in at least one of those areas, and that's why we're still seeing rampant heart disease. And in fact, these days, 70% of heart disease is due to people who have the insulin resistance gene. And the insulin resistance gene occurs in 30% of Caucasians, 50% of Asians, and almost 100% of people with darker skin. And if you've got that gene and you live in the modern society falling down in one of those areas I spoke about, it still markedly increases risk for heart disease. The other 20%, Ron, and this will come as no shock to you, is to pick the wrong relatives who've given you this high lipoprotein little a. So 90% of heart disease is due to either insulin resistance or lipoprotein little a, and the other 10% is due to a whole lot of other things. But so we're still seeing rampant heart disease. The number one cause of death and disability around the world, cardiovascular disease. One person in Australia dies every 12 minutes from some form of cardiovascular disease. The second commonest cause of death and disability is cancer. The third commonest cause of death and disability is Western healthcare.
Yes, that's right, isn't it? The use of prescription drugs as prescribed.
Oh, it's not just prescribed. prescription drugs. It's unnecessary procedures. It's doing the wrong operation on the wrong person. It's the superbugs that are killing people. It's things like unnecessary antibiotics. But in America, every year, there are over 100,000 deaths from the appropriate prescription of pharmaceutical drugs. So no one would disagree the person shouldn't have taken the drug, but we're talking about people dying as a consequence of prescribed drugs. And this is what irritates me when I hear these brain-dead conservatives in medicine who are criticising complementary medicine. Fix up the problem in your own backyard before you criticise people who are practising good complementary medicine. I just think that's where integrative medicine is important.
Yes, well, we won't go into the group. We could easily, who call themselves friends of science. I think what we really need is scrutineers of science, not really friends. But going back to that insulin resistance, I mean, this gets back to this sugar versus fat being the demon. Yeah. You mentioned good fats. Tell our listeners what good fats are.
Oh, look, I think good fats are anything apart from trans fats. Now, trans fats are the synthetic fats that you get from either the hydrogenation of vegetable oils causing trans fatty acids or the interesterification of fats, which is another technique they use so they can put on the side of the box, no trans fats. They just use interesterification. It's just another con job. But it's all synthetic fats. And what the synthetic fats do, the reason they're in food, is to thicken and harden the food. So when those synthetic fats get into our body, they thicken and harden our cell membranes to make them brittle and easy to be broken down. So this whole demonization of saturated fat, anyone who continues to say you've got to reduce your saturated fat in your diet is not looking at the current science. A few months ago, a study called the PURE study came out. The PURE study was done by Salim Youssef, who is one of the top epidemiologic researchers in the world from Canada. And this study looked at just over 135,000 people, 18 countries, followed for about 7.5 years, and found, wait for this one, those people who had the highest carbohydrate intake, and we're not talking about fruits and vegetables here, we're talking about the processed carbs, so what I call white death, so white bread, white rice, pasta, potatoes, any form of sugar. So those who had the highest carbohydrate intake had a 28% increased risk for death. 28% increased risk for death. Those who had the highest fat intake across the board had a 23% reduction in death rates. 23% reduction. Those who had the highest saturated fat intake had a 14% reduction. Wow. When I hear people saying saturated fat's bad for you, where's the damn evidence? Because it isn't there. For example, a study of 15,000 people, got it wrong, 30,000 people over 15 years in Europe looked at people's intakes of different foods and found that those who had the highest intake of high-fat dairy had a 23% reduction in type 2 diabetes. Let's forget about all this fat nonsense about how fat is bad for you. Fat does not cause coronary artery disease. It's complete nonsense, and anyone who says that just doesn't understand science.
Oh, Ross, music to my ears. And of course, the whole point about insulin resistance is this skyrocketing thing called diabetes, and that makes things very unstable, doesn't it?
Yeah, Ron, diabetes is like cancer of the blood vessels. So once you become diabetic, you're in trouble because you get this accelerated atherosclerosis, accelerated build-up of fat in the arteries. And so what happens is that the sugar in your bloodstream from the diabetes combines with the bad fats and combines with protein to cause these things called advanced glycosylated end products. So you end up with almost like little bits of toffee apple in your arteries. The diabetics are really the canaries in the coal mine, but it's not just the diabetics, it's also the pre-diabetics. And if you've got this insulin resistance gene, as I said, 30% of Caucasians have it, it's very easy to get diabetes, to get blood pressure, to put up not just your cholesterol, but your triglycerides and put down the HDL, the so-called good cholesterol. It actually isn't, but this is just the pattern you look for in the bloodstream, and fat around the belly. So the fat around the belly, which we've spoken about on a number of occasions, abdominal obesity, that is the bad fat. So you've got, like, a lot of women are concerned about the fat on the backside or the thighs, and it might look good in terms of what they're thinking, but it doesn't hurt them. What hurts is abdominal fat and fat around the throat, because that increases your risk for sleep apnea, which is certainly in your area. Mm-hmm. By the way, I just read through your magnificent new book, so anyone who's listening should get Ron's book. It's magnificent.
Oh, Ross, and I didn't even pay you to say that. I mean, you're right. Yeah, thank you so much.
Just tell everyone what it's called, thank you.
It is called The Life Less Stress, The 5 Pillars of Health and Wellness.
It's a beautifully researched book. It's really easy to read. So anyone who's listening, and Ron did not ask me to do this, you go out and buy his book. It's magnificent. Sorry, mate, keep going.
No, Ross. Well, you and I go back so long. Let's not even go there. Actually, we should. I think I worked it out just before we came on air, and I think, when we were at school together, that was almost 45 years ago or more even. Anyway, I digress. I get all nostalgic when I talk to you. But it's back to those fats, isn't it? I mean, the demonisation of the fats has pushed us into this, well, I know you don't like the expression, but high carb. Well, a high carb, and that's led to these people who are predisposed to diabetic actually becoming diabetic and the whole range of problems. But
and also, since we've become obsessed with dieting over the last 20, 30 years, we've got fatter. People should. I wrote a book 10 years ago called Diets Don't Work.
I was going to ask you about that.
Yeah, well, they don't work because people go on a diet like they go on a holiday. And recently on my show, I interviewed a fellow called Dr. Nick Fuller, who's a professor at the University of Sydney, an expert in obesity, and he agrees with me entirely, diets don't work. What you've got to do is, and I think I'd certainly advise people to get his book as well, it's called Interval Weight Loss. Right. And he says you've got to really trick your body. It's a bit like the 5-2 diet, where you trick your metabolism into thinking that you've changed for a day, but you go back to another way of eating, and so your body can never get used to it. Then you lose weight because you're tricking your body into changing your metabolism. Whereas if you go onto a diet, your body then just goes into starvation mode and just holds on to the fat. So it's crazy to even think about dieting. Dieting's ridiculous.
Well, I think the idea of 3 meals a day is another one that, when in human history was 3 meals a day a normal part of life?
Oh, it's only been recently, and people come to me and say, but Doc, I get starving at 10:30. Get over it. There's nothing wrong with a bit of hunger. Hunger doesn't hurt you. We were designed to wander around that jungle with a spear for 30, 40 years. You'd kill the beast, you'd eat the beast, you'd store a bit of fat in your belly, which is where the insulin resistance came into it, because people who are insulin resistant are much better hunter-gatherers than people who aren't. So you can store the fat for a day or two until the next big feed. But what do? Breakfast, lunch, dinner, we sit in our bums all day. And you wonder why we're still getting rampant cardiovascular disease. It's obvious.
Yeah. Now, listen, can't help but ask this question because you are a cardiologist. We've heard cholesterol. It's actually an integral part of our body. Remind our listeners of what cholesterol actually does.
Okay. Cholesterol is actually a steroid. It's not a fat. So a lot of people will be surprised about that one. It's the basic steroid ring for most of our hormones. So the cortisone-based hormones, a lot of the sex hormones are based around the steroid ring. So we need cholesterol. Cholesterol is a vital part of our cell membranes. So in a healthy person, our cell membranes, the covering of our cells, the protective coating that protects us against outside toxins, should be 75% fat, of which a lot of that's cholesterol, which is why I don't like fat-soluble statins, because they rip the cholesterol out of your membranes, Lipitor and Zocor, or atorvastatin, simvastatin. They're the fat-soluble statins. I don't use them at all because they rip the cholesterol out of the membranes and make the membranes leaky and permeable. So we need cholesterol, we need fat, and here's where everyone's getting it wrong. LDL cholesterol is said to be the bad cholesterol, and it isn't. HDL cholesterol is said to be the good cholesterol, and it isn't. They're both divided into subcomponents, and the major subcomponents are what we call small, dense LDL cholesterol and large, buoyant LDL cholesterol. Small, dense LDL cholesterol is the proatherogenic cholesterol that puts muck in your arteries. So I'll give you a great example here. I've got a 36-year-old patient who at age 36 has already had 3 stents in his arteries, 36 years old. Wow. The only abnormality he has in his bloodstream, no, he doesn't have lipoprotein(a), his cholesterol profile is normal. The only abnormality in his bloodstream is he's got a very high level of small LDL, small dense LDL, which I measured his subfractions, which most doctors don't do routinely. So I'm hammering his small dense LDL so he doesn't have to have any more stenting or bypass surgery. And this is where we've got to target our therapy. Large LDL, what that does do is build healthy cell membranes, as I mentioned before, improves the blood-brain barrier, which is a fatty membrane. It improves cell-to-cell communication, the basic steroid ring, as I said. It is important for bile salt metabolism, vitamin D metabolism. So we need large LDL. Also, when we're talking about HDL, Large HDL is also protective. That rips the cholesterol out of the arterial walls, whereas small HDL is pro-inflammatory, so that makes the whole atherosclerotic process worse. So just looking at a cholesterol profile doesn't tell you much. And I received an email this morning that I was reading from a long-standing patient of mine. She's got familial hypercholesterolemia, where her cholesterol sits at well above 8. And her GP is desperate to put her on a cholesterol-lowering pill, wants her to go and see one of Sydney's cholesterol experts to get her cholesterol lowered. But she's a woman in her late 50s. Her coronary calcium score is 0. She has nothing in her arteries. Now, a study that was done in the Journal of the American College of Cardiology, November 2015, followed 5,000 Yanks for 10 years over the age of 50 and found that 77% of the people in the trial fitted the US criteria to be on a statin to lower their cholesterol. But half of that 77% had a 0 calcium score, and their heart attack rate over the 10 years was so low that the conclusion of the trial is if you've got a 0 calcium score, you do not need a statin. You can ignore your cholesterol level. Now, I'm not saying just have a one-off 0 calcium score. I do them every 5 years for people with low calcium scores. Once you get a high calcium score or you have coronary disease, you can forget about ever having it done again because you need aggressive management. But we've got to stop this throwing around of cholesterol-lowering pills like lolly water. The only people who need a cholesterol-lowering pill are people who've had established heart disease, stent, heart attack bypass, or they have significant coronary atherosclerosis seen on a coronary calcium score. If your coronary calcium score is low or 0, you can forget about your cholesterol.
Well, Ross, I remember the last time you said that to me, I went off and got my coronary calcium CT score, and it wasn't good. It wasn't good. I mean, a lot of my listeners will be following some of my own other health stories, and I've certainly got a whole new respect for family history. So, you know...
Yeah, well, you've got a high lipoprotein delay, and let me tell you a story, and this is not speaking out of school because this man actually published this in his website. One of my best mates is a guy called Peter Switzer. Now, a lot of people would know Peter Switzer from Switzer Business and on Sky News, and I'm on his show once a month. He is, as I said, one of my best mates. He's in his mid-60s, and I said to Pete, look, you're long overdue for a coronary calcium score and a checkup with me. Your father died at 53 of heart disease. You've got to come in. I eventually convinced him to come in a couple of months ago. He was in atrial fibrillation when he arrived, didn't even know it, got him out of atrial fibrillation, put him on the treadmill, and his heart at rest on the echo didn't look that good, but at the end of exercise was dreadful, no symptoms, put him into the hospital, severe triple vessel disease, had bypass surgery. He's now fine, but he probably would have died in the next few months.
Yeah. Well, tell our listeners, you know, you've mentioned the coronary calcium CT score because a lot of our listeners would be exposed to the idea of getting an angiogram. And what's the difference? I mean, why?
Okay, well, and look, as you well know from bitter personal experience, I completely object to the intravenous CT coronary angiogram as a screening test for heart disease. It is not a screening test. It does not give you any extra prognostic information over the simple coronary calcium score, which is done with a CT scan, no dye, no injections, just measures how much muck you've got in your arteries. Now, the difference between the two tests is that, firstly, as I said, there's no extra prognostic information by the invasive intravenous dye test, but you are being exposed to dye that potentially you could have an allergic reaction to. These tests can be, with certain machines, up to 300 chest x-rays of radiation as opposed to the 4 or 5 with a coronary calcium score. So you glow in the dark for 3 days after you've had the test. And also the intravenous CT coronary angiogram makes your wallet $500 lighter. So there is no indication whatsoever to use the coronary CT angiography, the intravenous test, as a screening test for heart disease. There is strong indication, in my view, that all males at 50, all females at 60 should have a routine coronary calcium score if they don't have established heart disease. So my 36-year-old patient with the stents in his arteries wastes the time. There's no point doing it. But for somebody who, say, is a male's just hit 50, maybe his father had a heart attack at 75, or somebody in the family's on a cholesterol-lowering pill and his cholesterol's nudging up, have the coronary calcium score. You know exactly where you are.
Yeah, and I remember once saying to me, and still rings in my ear, and it's why I'm not reading it, said anything over 400, don't read Tolstoy.
Yeah, that's right. Keep away from Tolstoy. No, don't read Tolstoy without treatment. But the point is, like Pete Switzer's coronary calcium score was, I think, 476. But if you have it and you get something done about it, well, then, I mean, Peter will live for another 40 years now. He's had an excellent operation. He'll be on appropriate therapy. You'll live for another 40 years as well because you're under my care. So there you go.
Thanks, Ross. Now, listen, what do you think some of the biggest challenges people face today when they're dealing with their health? I mean, you've identified the 5 things, but you know, what's standing in the way of people getting on with it?
Oh, look, I just think life. I think the biggest challenge these days is our modern society. And you see, this is a really interesting thing. We all think that with all these extra luxuries we have on the planet, that life's so much easier. But it's interesting that people in their 20s and 30s say, I'll work really hard for the next 10 years, then I'll retire. But when they hit their mid-30s or 40s, they've now got the mortgage and the 2 cars, because you have to have 2 cars, and they've got to have their smashed avocados and their double-shot lattes every day. And all of these things become expensive. And so, and also, if you think about when you and I were kids, we were at school, anything at all like that, if you wanted to make some comments to somebody, you would write them a letter. That letter would be posted. The person would get the letter 2 or 3 days later, and you might get an answer a week or so later. And you would only write something down if it was really important. These days, people will have a thought in their head, put it on social media, send an email to someone, expect a result in 5 seconds. If they don't get the message back straight away, they're all upset. And so we're getting these rubbish emails. We might get 10, 20, 30, 50, 100 a day, and some of them have to be dealt with. And it's wasting our time on nonsense. And all of this stress is creating stress for everyone's just time poor, they're stressed, they're unhappy with their lives, they're not putting their effort into where they should be putting their effort in. So I think that's the biggest challenge associated with today's life. It's too much for too many people.
And I mean, your 5 tips, which I love, and I know you've written a book on that very subject, and we're going to have links to your webpage, of course, because you've written how many books now? 7?
7, yeah.
7 books.
Well, sort of 8 if you want to throw in another e-book I wrote called How to Reverse Heart Disease, but 7 that have been published in bookstores.
And of course, you've got your weekly program on
the Talking Lifestyle Network, which goes throughout Australia. We go on Sunday nights, 6 to 8 on a Sunday night, so it's 9:54 a.m. in Sydney. It's the Magic Network in Brisbane and Melbourne. I can't remember the numbers. I think it's 884 in Brisbane and 1126 in Melbourne.
We'll have links to all.
And Perth as well. So we go through Australia 6 to 8 on a Sunday night. Healthy Living, the show's called.
Yeah. Well, Ross, thank you so much for today. We always have a good chat and always enjoy catching up. So we'll have links to your website and your program. And until the next time, thank you.
Hope to talk to you soon, mate.
So fats are not the problem, which is something I identify in my book. You'll hear it repeatedly on this podcast. I mean, we have to redress the balance. This is a theme, I got to tell you now, folks, this cholesterol story, this demonizing saturated fat story is not going away anytime soon. There are just too many reputations that are at stake here. There are too many organisations that are making a great deal of money out of it. So I think what we want to focus on is some independent advice, independent of pharmaceutical industry, independent of the food industry, etc. So that's going to be a recurring theme, and it's great to hear it from my cardiologist. And of course, the whole cholesterol story as well. And when you read about it, when you discuss it, I'm telling you, talk about public health messages. I mean, there was a Harvard study which looked at the evidence as to whether statins were good for your health. Okay, now the key question in this study was, are statins, which lower cholesterol, good for your health? And funnily enough, in this Harvard study, they found that when industry did those studies, they were 20 times more positive than when independent studies were done. Well, of course, the statin industry is not going to let that one lie, so they actually engaged the London School of Economics to do a study to test whether industry-funded studies were as reliable or consistent as independent studies, and their conclusion was there was no difference. So talk about confusing health messages, and I told you before, they're not going to let this one go. But when you read the fine print, in fact, when you read the methodology, the question that was asked in the first Harvard study was, does cholesterol make a difference to a person's health? And when that question was asked, the results were 20 times more positive for industry-funded studies than non-industry. But the LSE study, the London School of Economics study, asked the question, do statins lower cholesterol? Now, no one is going to argue with that. And so industry-funded studies and independent studies will all agree. But as you will have got from this podcast, I hope, and that is cholesterol is really not the problem. It really depends. And family history is important. Let's get that straight. So that's really important. And most importantly is the message that Ross shares with millions of people. I love those 5 tips. And those 5 tips, just to recap, were no addictions, sleep, hey, we mentioned that a lot on our podcast, eat less, but eat more nourishing food and processed food, of course, it's a no-brainer. Exercise, we're going to do a whole lot of work on exercise. And happiness. Well, we're going to focus more on thinking. Happiness is somewhat, can be a bit hard to achieve sometimes, and if we get preoccupied by that. But happiness and how we think about things is critically important. And with those 5 things, you've got at least a 70% chance of reducing all chronic disease. So that's pretty good. Anyway, look, I hope you enjoyed it. And until next time, this is Dr. Ron Ehrlich. Be well. This podcast provides general information and discussion about medicine, health, and related subjects. The content is not intended and should not be construed as medical advice or as a substitute for care by a qualified medical practitioner. If you or any other person has a medical concern, he or she should consult with an appropriately qualified medical practitioner. Guests who speak in this podcast express their own opinions.